Next, I get to talk to you about our sleep study here. Start my timer. So, thank you to those who've already participated in this study. We all know how it feels to be sleep deprived or to go a couple nights with very little sleep. So much of this will be familiar, but I'm going to try and add to it. So our goal is to really better understand how sleep changes with neurodegenerative disease to be able to improve sleep and wakefulness. So we're trying to think of an intervention as we're working through discovering what changes with sleep. So with the lack of sleep, we all know that there's some cognitive impairment. So it becomes harder to bargain with other people. We become less trusting. Our risk-taking increases, even though our judgment decreases, and it's harder to make clearer decisions. And it's harder to regulate our emotions or to recognize other people's emotions or even express emotion. There's also physiological changes. So there's increased sensitivity to pain. There's an imbalance in our hormones, especially those related to appetite and sugar regulation. And we also become less stable, or we have a loss of balance. So even those in the room that got up a little earlier than we maybe wanted to this morning, you're probably feeling like you're slumping into your chairs, you're leaning on the desk a little bit more. And so if we think about when we're trying to walk tall and proper, if we're tired or sleepy, we're going to droop down, throwing off our center of balance. So we've seen that sleep disruption impairs the cellular processes associated with cognition. It even increases our likelihood of developing mild cognitive impairment and is one of the main non-cognitive predictors for developing cognitive impairment within a 2-year period. And this bottom study was a great one where they looked at sleep quality across several nights, and every day they measured cognition. And people's diagnoses actually changed day to day depending on how well they slept the night before. So there's a number of factors that can lead to sleep disruption, but before I get into that, what do we look at for your sleep? So we look at how much time you spend in this non-REM sleep. So this is where you're kind of in that dozy to light sleep, and then you get that heavy, deep sleep feel. We look at how much time you spend in REM sleep and how often that occurs, and that's where we normally have our dreams. We also look at how long it takes you to initially fall asleep. Is it a short time or is it a long time? And how many times do you wake during the night, and how long are you actually awake during those periods? So as I mentioned, there are a number of factors that can wake someone up during the night. If you're in pain, you'll wake up. If you have to go to the bathroom, you'll wake up. Sleep disorders can often wake us up as well, and we'll be looking for those. So just to touch, while I have an audience, we're going to see someone who has severe sleep apnea. This is much more severe than we would expect in general population. I want to just show this so people can be aware and look out for sleep apnea in loved ones. So this is someone trying to breathe. They're breathing here, and then he's going to stop breathing, and it actually happens 122 times per hour for this individual. And you can see his shoulders doing a slight jerking motion, and that's where he's trying to breathe but isn't actually able to breathe. In a couple seconds, we'll see his eyes open up, and that's where he's actually briefly waking up, but he wouldn't remember this the next day. So that's where his eyes just opened, so he woke himself up. So he hadn't been able to breathe in the entire time that I was quiet for. So that was courtesy of you two. There are many treatments for sleep apnea, so I just want you to be aware that this is something treatable that can contribute to how sleepy someone is. Other factors that can affect how disrupted someone's sleep is or how sleepy someone is during the day is the nuclei that control sleep within the brain, and that's what we're looking at here. So different nuclei networks control different parts of that sleep-wake balance. And these are the same brain regions that are earliest affected in PSP. So in particular with PSP, we expect severe changes in someone's sleep-wake balance. So our goals in our sleep study here at the Memory and Aging Center is to characterize the sleep-wake disruptions and associated neuropathology present in PSP. To do this, we're identifying the presence of sleep disorders, including sleep apnea, which I just showed you. To determine differences in the sleep-wake cycle, so this is both how much you're waking up during the night and how much you're sleeping during the day. We're trying to validate an at-home sleep recording device so that in the future we won't always have to bring people into a clinical setting for a full understanding of what sleep looks like. And our goal is to also develop an intervention to improve sleep patterns, so to really understand what is changing in sleep that's related to disease versus individualistic changes that occur. So using our techniques, we're able to hopefully develop a very guided and goal-directed intervention. So to do our sleep study, at the moment, we have an at-home component, which some of you have already enrolled for. And so this is where we're sending you home with a few devices. It's a simple headband and a wristband to measure your sleep at home. And then for some individuals, we may also ask you to come in for an overnight clinical assessment, especially if you have PSP. And this is where we can do a full sweep to look for sleep disorders and to understand really what's happening with your sleep patterns. And we'll also look to see how sleepy you are during the following day. So I'd like to thank a number of people, in particular all of my participants so far. And I'd also like to thank the Tau Consortium for funding our study. So thank you.